AMCA Study Guide Questions, 136 questions with explained answers. Question 1. Name this part of the electrocardiogram. Option A, R2R interval. Option B, ST segment. Option C, PR segment. Option D, QRS complex. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 2. The three kinds of blood cells are: Option A, leukocytes, red blood cells, erythrocytes. Option B, erythrocytes, platelets, thrombocytes. Option C, leukocytes, white blood cells, platelets. Option D, erythrocytes, thrombocytes, leukocytes. The correct answer is option D, erythrocytes, thrombocytes, leukocytes. Explanation. The three major formed elements of blood are erythrocytes, leukocytes, and thrombocytes, which are red blood cells, white blood cells, and platelets. Question 3. Which of the following blood pressure readings would be considered stage 1 hypertension? Option A, 148/96. Option B, 116/72. Option C, 126/84. Option D, 178/104. The correct answer is option A, 148/96. Explanation. The source classifies 148/96 as stage 1 hypertension. Blood pressure categories can vary by guideline and era, so use the classification system required by the course. Question 4. The amount of blood pumped by the heart per minute is called: Option A, ejection fraction. Option B, cardiac output. Option C, contractility. Option D, blood pressure. The correct answer is option B, cardiac output. Explanation. Cardiac output is the volume of blood the heart pumps in 1 minute and is commonly described as heart rate multiplied by stroke volume. Question 5. Which is the most common route of administration of nitroglycerin? Option A, intravenous. Option B, intradermal. Option C, suppository. Option D, sublingual. The correct answer is option D, sublingual. Explanation. Sublingual nitroglycerin is placed under the tongue for rapid absorption, which allows a quick effect when it is prescribed for acute angina symptoms. Question 6. A murmur is an abnormal sound that may indicate: Option A, intestinal obstruction. Option B, valvular heart disease. Option C, stroke. Option D, bronchial asthma. The correct answer is option B, valvular heart disease. Explanation. A heart murmur is an extra or unusual sound caused by turbulent blood flow and may be associated with abnormal heart valves. Question 7. Choose the answer that corresponds with letter F. Option A, basilic vein. Option B, medicancubital vein. Option C, radial artery. Option D, cephalic vein. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 8. A patient came to the clinic for a low-grade fever of 1 month duration. As part of the laboratory workup, the physician ordered erythrocyte sedimentation rate. What color tube would be used for this test? Option A, green top tube. Option B, light blue top tube. Option C, lavender top tube. Option D, red top tube. The correct answer is option C, lavender top tube. Explanation. The source keys a lavender top tube for erythrocyte sedimentation rate testing. Collection requirements can vary by laboratory method, so the laboratory protocol should be followed. Question 9. A collection tube containing an anticoagulant must be inverted how many times? Option A, tubes containing anticoagulants are not inverted at all. Option B, 10 times. Option C, 8 times. Option D, shake vigorously for 30 seconds. The correct answer is option C, 8 times. Explanation. Anticoagulant tubes are gently inverted several times so blood mixes evenly with the additive and small clots do not form. The source specifies 8 inversions for this item. Question 10. What is the best location to check the pulse of an adult who is unconscious and not breathing? Option A, at the carotid artery of the neck. Option B, on the chest, directly over the heart. Option C, at the radial artery of the wrist. Option D, at the brachial artery of the arm. The correct answer is option A, at the carotid artery of the neck. Explanation. The carotid artery is a central pulse site that is commonly checked in an unresponsive adult because it can remain palpable when peripheral pulses are weak. Question 11. The act of listening for sounds made by internal organs to aid in the diagnosis of certain disorders is called: Option A, menstruation. Option B, percussion. Option C, auscultation. Option D, palpation. The correct answer is option C, auscultation. Explanation. Auscultation means listening to internal body sounds, usually with a stethoscope, such as heart, lung, and bowel sounds. Question 12. Samples appear to have been mislabeled and mixed on 2 patients. Each outpatient has orders for both blood and urine test, so there were 2 samples for each. What would be the best course of action? Option A, recollect all 4 specimens from the patients. Option B, relabel the urine samples, but redraw the blood. Option C, have the patients come back and identify their specimens. Option D, relabel all the specimens. The correct answer is option A, recollect all 4 specimens from the patients. Explanation. When patient specimens may be mislabeled, the safest action is to reject the questionable specimens and recollect them using correct identification procedures rather than guess which sample belongs to whom. Question 13. You performing a venipuncture procedure on a patient. The needle appears to be inside the vein yet no blood ID flowing into the tube. What should you do? Option A, pull back on the needle. Option B, terminate the procedure. Option C, slightly rotate the needle. Option D, switch the tubes. The correct answer is option D, switch the tubes. Explanation. If the needle appears to be in the vein but no blood enters the tube, a defective tube with lost vacuum is one possible cause, so changing the tube is an appropriate troubleshooting step. Question 14. The patient complains that it hurts when they swallow. This type of complaint is considered option A, assessment. Option B, plan. Option C, objective. Option D, subjective. The correct answer is option D, subjective. Explanation. Pain with swallowing is a symptom reported by the patient, so it is subjective information rather than an objective finding directly measured by the examiner. Question 15. The term used to describe sophisticated and highly complex care is option A, managed care. Option B, tertiary care. Option C, secondary care. Option D, primary care. The correct answer is option B, tertiary care. Explanation. Tertiary care is highly specialized, complex care that often involves advanced technology and subspecialty expertise. Question 16. Which limb sensor is the reference or ground electrode? Option A, right arm. Option B, left arm. Option C, left leg. Option D, right leg. The correct answer is option D, right leg. Explanation. The right leg sensor serves as the reference or ground electrode in the standard electrocardiogram limb electrode arrangement. Question 17. Which of the following is the most common means of transmitting pathogens? Option A, ingesting food. Option B, blood transfusions. Option C, coughing. Option D, touching. The correct answer is option D, touching. Explanation. Hands and touch are common ways pathogens move between people and surfaces, which is why hand hygiene is one of the most important infection prevention measures. Question 18. The correct lead from the right arm to the leg is option A, augmented voltage right arm lead. Option B, augmented voltage foot lead. Option C, lead 3. Option D, lead 2. The correct answer is option D, lead 2. Explanation. Standard limb lead 2 records the electrical potential from the negative right arm electrode toward the positive left leg electrode. Question 19. Regulation of the heart rate, speed of electrical conduction and strength of contraction are influenced by the brain via the nervous system. Option A, autonomic. Option B, somatic. Option C, core. Option D, voluntary. The correct answer is option A, autonomic. Explanation. The autonomic nervous system regulates involuntary cardiac functions such as heart rate, conduction speed, and force of contraction through sympathetic and parasympathetic influences. Question 20. If a laboratory test requires serum, which vacutainer tube is the tube of choice? Option A, lavender top tubes. Option B, black top tubes. Option C, yellow top tubes. Option D, red top tubes. The correct answer is option D, red top tubes. Explanation. A red top tube allows blood to clot so serum can be separated, making it appropriate for tests that require serum. Question 21. All pathogens are option A, microorganisms that live in soil. Option B, microbes that can cause disease. Option C, communicable microorganisms. Option D, normal bacteria found on skin. The correct answer is option B, microbes that can cause disease. Explanation. A pathogen is a microorganism or other infectious agent capable of causing disease in a host. Question 22. How far above the site of draw is the tourniquet placed? Option A, 3-4 inches. Option B, 1-2 inches. Option C, 5-7 inches. Option D, 4-6 inches. The correct answer is option A, 3-4 inches. Explanation. Placing the tourniquet about 3 to 4 inches above the intended puncture site helps make the vein more prominent without obstructing access to the site. Question 23. Which of the following is an example of negative kinesics? Option A, smiling. Option B, eye contact. Option C, frowning. Option D, good grooming. The correct answer is option C, frowning. Explanation. Kinesics refers to body movement and nonverbal expression. Frowning communicates a negative nonverbal message. Question 24. The tube of choice for glucose testing is option A, gray top tube. Option B, red top tube. Option C, light blue top blue. Option D, lavender top tube. The correct answer is option A, gray top tube. Explanation. Gray top tubes contain additives that slow glycolysis, helping preserve glucose concentration in the specimen before laboratory analysis. Question 25. A female patient came into the emergency room with her husband. She was suffering from severe shortness of breath. She appeared to be unable to take in sufficient oxygen. What is the color of the skin and nail beds? Option A, brownish. Option B, greenish. Option C, reddish. Option D, bluish. The correct answer is option D, bluish. Explanation. Bluish discoloration of the skin or nail beds can indicate cyanosis, which occurs when the blood contains an increased amount of deoxygenated hemoglobin. Question 26. Which of the following supplies blood to the heart muscle? Option A, coronary arteries. Option B, brachial arteries. Option C, carotid arteries. Option D, cerebral arteries. The correct answer is option A, coronary arteries. Explanation. The coronary arteries branch from the aorta and deliver oxygenated blood directly to the heart muscle. Question 27. A patient came into the doctor's office with chest pain and shortness of breath. Which position is the best to help him breathe better? Option A, lithotomy. Option B, prone. Option C, Fowler's. Option D, supine. The correct answer is option C, Fowler's. Explanation. Fowler's position raises the head and upper body, which can improve chest expansion and make breathing easier for a patient with shortness of breath. Question 28. Which body system has the liver, gallbladder and pancreas as accessory organs? Option A, digestive. Option B, endocrine. Option C, integumentary. Option D, lymphatic. The correct answer is option A, digestive. Explanation. The liver, gallbladder, and pancreas are accessory organs of digestion because they produce, store, or deliver substances that help digest food. Question 29. Telephone etiquette involves option A, remaining anonymous to avoid any responsibility. Option B, leaving a person on hold until you have the answer. Option C, referring an emotional caller to the administrator. Option D, keeping your statements simple and to the point. The correct answer is option D, keeping your statements simple and to the point. Explanation. Clear, brief statements make telephone communication easier to understand and reduce confusion, especially when giving routine office information. Question 30. When medical assistants are able to adapt to various situations, they are considered to be option A, courteous. Option B, flexible. Option C, dependable. Option D, loyal. The correct answer is option B, flexible. Explanation. Flexibility is the ability to adjust behavior or plans when circumstances change, which is important in a busy medical office. Question 31. Which of the following skills would not be an appropriate expectation of the competent medical assistant? Option A, giving instructions to patients about self-care after treatments. Option B, diagnosing common patient symptoms. Option C, performing insurance coding and billing. Option D, using the computer to perform a variety of office functions. The correct answer is option B, diagnosing common patient symptoms. Explanation. Diagnosing symptoms is a provider-level clinical responsibility and is not an appropriate independent duty for a medical assistant. Question 32. Defamation through spoken statements is known as option A, libel. Option B, sympathy. Option C, empathy. Option D, slander. The correct answer is option D, slander. Explanation. Slander is defamation communicated through spoken words, while libel generally refers to defamation in written or recorded form. Question 33. Mr. Matthews called the office to get the test results for his wife, Martha. What should the medical assistant do? Option A, tell Mr. Matthews that you cannot release the information. Option B, check the medical record to see if Mr. Matthews is really Martha's husband, if so then release the information. Option C, tell Mr. Matthews the test results. Option D, check the medical record to see if Mr. Matthews is authorized to have this information on Mrs. Matthews' Health Insurance Portability and Accountability Act form. If so, then release the information. The correct answer is option D, check the medical record to see if Mr. Matthews is authorized to have this information on Mrs. Matthews' Health Insurance Portability and Accountability Act form. If so, then release the information. Explanation: test results may be released to a spouse only when the patient has authorized that disclosure or another valid legal basis exists, so the medical record must be checked before information is shared. Question 34. The insurance carrier is allowed to use any method to determine the amount for a service, also known as the Option A, fee schedule. Option B, deductible. Option C, allowed amount. Option D, insurance premium. The correct answer is now shown. Explanation: the source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 35. Which of the following procedures can be performed by a medical assistant? Option A, intramuscular injection. Option B, start fluids through a catheter. Option C, insert peripheral catheter. Option D, intravenous injection. The correct answer is option A, intramuscular injection. Explanation: intramuscular injections are within the usual delegated clinical duties of a properly trained medical assistant when permitted by state law and office policy, while intravenous procedures may require different authorization. Question 36. Veterans with service-related disabilities are eligible for care under which of the following programs? Option A, TRICARE. Option B, VetServe. Option C, Civilian Health and Medical Program of the Department of Veterans Affairs. Option D, CHAMP Aid. The correct answer is now shown. Explanation: the source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 37. Which drug is used as an anticoagulant? Option A, fluoxetine Prozac. Option B, warfarin Coumadin. Option C, digoxin Lanoxin. Option D, triazolam halcyon. The correct answer is option B, warfarin Coumadin. Explanation: warfarin is an anticoagulant that reduces formation of vitamin K-dependent clotting factors and is used to reduce the risk of harmful blood clots. Question 38. Which of the following are also referred to as serum separator tubes? Serum separator tube. Option A, red and gray top tubes. Option B, red top tubes. Option C, light blue top tubes. Option D, lavender top tubes. The correct answer is option A, red and gray top tubes. Explanation: red and gray marbled tubes are serum separator tubes because they contain a gel barrier that separates serum from blood cells after centrifugation. Question 39. The way to organize appointment scheduling so that it best supports the success of the practice is to: Option A, include a lot of time physician's administrative activities. Option B, allow frequent breaks. Option C, consider the preferences of the physician. Option D, schedule as many patients as possible throughout the entire day. The correct answer is option C, consider the preferences of the physician. Explanation: considering the physician's working preferences helps create a realistic schedule that supports workflow, patient access, and the way the practice is actually run. Question 40. Which of the following requires all employees workplace hazard training? Option A, standard precautions. Option B, bloodborne pathogen. Option C, emergency action plans. Option D, hazard communication standard. The correct answer is option D, hazard communication standard. Explanation: the hazard communication standard requires employers to provide information and training about hazardous chemicals that employees may encounter in the workplace. Question 41. What is the process used to wash and remove blood and tissue from medical instruments called? Option A, asepsis. Option B, sanitization. Option C, disinfection. Option D, sterilization. The correct answer is option B, sanitization. Explanation: sanitization is the cleaning step that removes visible soil, blood, and tissue from instruments before higher-level disinfection or sterilization when required. Question 42. Which of the following is the best specimen to test for levels of iron in the blood? Option A, the one collected in a tube that contains sodium citrate. Option B, the one collected in a microcuvette. Option C, the one collected in the tube that contains ethylenediamine tetrashic acid. Option D, the one collected in a tube with no additive. The correct answer is option C, the one collected in the tube that contains ethylenediamine tetrashic acid. Explanation: the source keys the tube containing ethylenediamine tetrashic acid. Because iron testing methods can depend on the laboratory protocol, this item should be checked against the specific course or laboratory standard being used. Question 43. What is the name of the heart valve that separates the right atrium and right ventricle and? Option A, aortic valve. Option B, tricuspid valve. Option C, pulmonic valve. Option D, mitral valve. The correct answer is option B, tricuspid valve. Explanation. The tricuspid valve lies between the right atrium and right ventricle and prevents backward flow into the atrium during ventricular contraction. Question 44. A routine hand wash procedure uses plain soap to remove soil and transient bacteria. Option A, scrub brushes. Option B, antimicrobial soap. Option C, gel-based creams after the routine hand wash. Option D, medicated towels for drying clean hands. The correct answer is option B, antimicrobial soap. Explanation. The source keys antimicrobial soap, but the stem states that routine handwashing uses plain soap. This item is internally inconsistent and should be reviewed against the original course material before use. Question 45. Sodium citrate is the additive in what color tube? Option A, red. Option B, green. Option C, light blue. Option D, lavender. The correct answer is option C, light blue. Explanation. Light blue tubes contain sodium citrate, an anticoagulant used primarily for coagulation testing because it binds calcium in a controlled ratio. Question 46. Which of the following is an example of a biohazard? Option A, spilling a chemical on a countertop. Option B, splashing of blood when a cap is removed. Option C, touching electrical equipment with wet hands. Option D, the potential for a fire to start. The correct answer is option B, splashing of blood when a cap is removed. Explanation. Blood is potentially infectious biological material, so a splash of blood is a biohazard exposure rather than a chemical, electrical, or fire hazard. Question 47. This is federal program that provides medical care for the indigent. Option A, Public Health Service. Option B, Medicaid. Option C, Medicare. Option D, Health Insurance Portability and Accountability Act. The correct answer is option B, Medicaid. Explanation. Medicaid is a joint federal and state program that provides health coverage to eligible people with limited income and other qualifying circumstances. Question 48. Important information a patient should know about immunizations would be that. Option A, they are not necessary if quality infection is maintained. Option B, they are prophylactics against deadly diseases. Option C, they are known to cause autism. Option D, they can unintentionally give the recipient a disease. The correct answer is option B, they are prophylactics against deadly diseases. Explanation. Immunizations are preventive measures that prepare the immune system to respond to specific infectious diseases before exposure causes serious illness. Question 49. The ability to identify with someone else's feelings is called. Option A, respect. Option B, feedback. Option C, sympathy. Option D, empathy. The correct answer is option D, empathy. Explanation. Empathy is the ability to understand and identify with another person's feelings while maintaining an appropriate professional perspective. Question 50. A round, raised skin lesion with itching that is a positive sign of reaction to allergic testing is A. Option A, wheal. Option B, nodule. Option C, papule. Option D, vesicle. The correct answer is option C, papule. Explanation. The source keys papule, but allergy skin testing is commonly described as positive when a wheal develops. This item should be reviewed because the supplied key and standard terminology may not agree. Question 51. Notifiable infection must be reported to. Option A, the patient's physician. Option B, your supervisor. Option C, World Health Organization. Option D, Center for Disease Control. The correct answer is option D, Center for Disease Control. Explanation. The source keys the Centers for Disease Control and Prevention. In practice, reporting usually follows state or local public health rules, so this item should be checked against the jurisdiction and course standard being taught. Question 52. The contraction phase of the heartbeat is called. Option A, systole. Option B, diastole. Option C, tachycardia. Option D, pacemaker. The correct answer is option A, systole. Explanation. Systole is the contraction phase of the cardiac cycle, when the ventricles contract and eject blood into the pulmonary artery and aorta. Question 53. Your patient is experiencing chest pain and has a heart rate of 132 beats per minute. You attach the electrocardiogram monitor and see a fast, regular rhythm with a round upright P wave that precedes each Q or S complex. The QRS complexes are 0.1 seconds in duration. This patient is experiencing option A, junctional escape rhythm, option B, sinus tachycardia, option C, complete atrioventricular heart block, option D, idioventricular rhythm. The correct answer is option B, sinus tachycardia. Explanation: a fast regular rhythm with a normal upright P wave before every narrow Q or S complex is characteristic of sinus tachycardia because the rhythm is still originating from the sinus node. Question 54. A tympanic temperature means the body temperature is measured. Option A, under the armpit. Option B, under the tongue. Option C, at the eardrum. Option D, in the rectum. The correct answer is option C, at the eardrum. Explanation: tympanic temperature is measured at the ear canal near the tympanic membrane, also called the eardrum. Question 55. Coinsurance is calculated based on A. Option A, a capitation rate. Option B, percentage of charge. Option C, a fixed charge for each visit. Option D, number of policyholders in the plan. The correct answer is option B, percentage of charge. Explanation: coinsurance is the portion of an allowed charge that the insured person pays as a percentage after applicable plan rules are met. Question 56. Insulin syringes are calibrated in option A, milliliters, option B, units, option C, cubic centimeters, option D, minims. The correct answer is option B, units. Explanation: insulin syringes are marked in insulin units so the ordered dose can be measured according to the insulin concentration. Question 57. When using a ventrogluteal approach to give an intramuscular injection in the buttock area, what is the muscle the medication goes in? Option A, gluteus maximus. Option B, gluteus medius. Option C, right upper and outer quadrant. Option D, gluteus minimus. The correct answer is option B, gluteus medius. Explanation: the ventrogluteal intramuscular site overlays the gluteus medius and is selected because it provides a thick muscle mass away from major nerves and blood vessels. Question 58. During assessment, the best source from which to obtain patient information is the option A, the medical record. Option B, physician's notes. Option C, a family member. Option D, the physician. The correct answer is option A, the medical record. Explanation: the medical record is the organized source of documented patient information, including history, medications, allergies, prior findings, and treatment information. Question 59. A fluctuating fever that returns to or below baseline then increases again is option A, intermittent. Option B, remittent. Option C, onset. Option D, continuous. The correct answer is option A, intermittent. Explanation: an intermittent fever returns to normal or below the fever threshold between episodes before rising again. Question 60. The four symptoms of inflammation are erythema, edema, pain, and option A, irritation. Option B, vomiting. Option C, heat. Option D, headache. The correct answer is option C, heat. Explanation: the classic local signs of inflammation include redness, swelling, pain, and heat caused by increased blood flow and inflammatory activity in the affected area. Question 61. Identify the rhythm that will often produce an irregular rhythm. Option A, atrial tachycardia. Option B, sinus dysrhythmia. Option C, ventricular tachycardia. Option D, sinus bradycardia. The correct answer is option B, sinus dysrhythmia. Explanation: sinus dysrhythmia produces a rhythm that varies with the respiratory cycle, so the intervals between beats can appear irregular while the impulses still originate in the sinus node. Question 62. The term refers to the list of charges for each of the provider's services. Option A, fee schedule. Option B, coinsurance. Option C, copayment. Option D, cost sheet. The correct answer is now shown. Explanation: the source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 63. After a patient interview by the medical assistant, which of the following should not be recorded by the medical assistant? Option A, family medical history. Option B, examination narrative. Option C, chief complaint. Option D, medication allergies. The correct answer is option B, examination narrative. Explanation: the medical assistant may document information obtained during the interview, but the provider's examination narrative belongs to the provider's clinical examination and should not be independently created by the assistant. Question 64. The privacy rule gives patients the right to option A, access their medical record. Option B, access their ex-spouse's record. Option C, sue the doctor. Option D, refuse treatment. The correct answer is option A, access their medical record. Explanation. The privacy rule gives patients important rights over their health information, including the right to inspect or obtain copies of much of their medical record. Question 65. Two premature ventricular complexes in a row are called A and N of premature ventricular complexes. Option A, deuce. Option B, couplet. Option C, bigemini. Option D, double. The correct answer is option B, couplet. Explanation. Two premature ventricular complexes occurring consecutively are called a couplet. Question 66. Collection devices used in skin punctures are called. Option A, capillary tubes. Option B, butterfly sets. Option C, blood culture collection systems. Option D, 25-gauge needles. The correct answer is option A, capillary tubes. Explanation. Capillary tubes are designed to collect small blood samples obtained by skin puncture, such as from a finger or heel. Question 67. The patient's chart indicates a urine sample was collected at 1,800. This means the sample was collected at option A, 8 inches the morning, option B, 8 inches the evening, option C, 6 inches the morning, option D, 6 inches the evening. The correct answer is option D, 6 inches the evening. Explanation. Military time 1,800 corresponds to 6 inches the evening because times after noon are converted by subtracting 12 from the hour number. Question 68. The amount that an insurance company may say is not allowed and not the responsibility of the patient, for a contracted physician, would be identified as this on the patient's account. Option A, a payment. Option B, an adjustment. Option C, a charge. Option D, a deductible. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 69. Which of the following should be used to chill a specimen as it transported? Option A, a small freezer unit. Option B, frozen blocks of ice. Option C, crushed ice. Option D, tepid water. The correct answer is option C, crushed ice. Explanation. Crushed ice surrounds the specimen closely and provides efficient chilling when a test requires transport at a low temperature. Question 70. A patient has been taking aspirin for arthritis. Which of the following is most likely to be affected by it? Option A, bleeding time. Option B, glucose time. Option C, blood culture collection. Option D, blood culture results. The correct answer is option A, bleeding time. Explanation. Aspirin inhibits platelet function, so it can prolong bleeding time and increase the tendency to bleed. Question 71. Which of the following statements is true under the doctrine of respondeat superior? Option A, the physician is responsible for any errors made by the medical staff. Option B, the person who has been employed for the longest period of time is responsible for any errors made by the medical staff. Option C, the medical administrative assistant is responsible for any errors made by the medical staff. Option D, the medical administrative assistant is superior to other members of the medical staff. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 72. A blood sample is collected from a patient and the plasma is pink to red in color. Which of the following is the most likely cause? Option A, polycythemia. Option B, hemolysis. Option C, lipema. Option D, agglutination. The correct answer is option B, hemolysis. Explanation. Hemolysis releases hemoglobin from ruptured red blood cells, which can make serum or plasma appear pink to red. Question 73. A physician, specialist or any person that provides medical care is known as the Option A, provider. Option B, policyholder. Option C, subscriber. Option D, dependent. The correct answer is option A, provider. Explanation. A provider is a healthcare professional or organization that supplies medical services to patients. Question 74. A monitor that a patient wears for 24 hours is called an. Option A, Holter. Option B, 12-lead. Option C, Holter. Option D, echocardiogram. The correct answer is option C, Holter. Explanation. A Holter monitor records the heart's electrical activity continuously during normal daily activities, commonly for about 24 hours or longer. Question 75. What is the best sample for the determination of blood pH and blood gases? Option A, cerebrospinal fluid. Option B, arterial blood. Option C, venous blood. Option D, capillary blood. The correct answer is option B, arterial blood. Explanation. Arterial blood is preferred for blood gas testing because it best reflects oxygenation, ventilation, and acid-base status after gas exchange in the lungs. Question 76. How many electrodes are used as part of a 12-lead electrocardiogram? Option A, 10. Option B, 6. Option C, 12. Option D, 8. The correct answer is option A, 10. Explanation. A standard 12-lead electrocardiogram uses 10 electrodes to generate 12 electrical views of the heart. Question 77. Choose the answer that corresponds with letter B. Option A, brachial artery. Option B, cephalic vein. Option C, ulnar artery. Option D, radial artery. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 78. No anticoagulants are found in which of the following tubes? Option A, green-topped. Option B, yellow-topped. Option C, lavender-topped. Option D, red-topped. The correct answer is option D, red-topped. Explanation. A plain red-topped tube traditionally contains no anticoagulant, allowing the blood to clot so serum can be separated after centrifugation. Question 79. The interval between exposure to infection and the appearance of the first symptom is called. Option A, incubation period. Option B, active period. Option C, means of transmission period. Option D, incineration period. The correct answer is option A, incubation period. Explanation. The incubation period is the time between exposure to an infectious agent and the appearance of the first signs or symptoms of disease. Question 80. Which of the following vacutainer tubes is routinely used for hematology testing? Option A, light blue top tubes. Option B, red top tubes. Option C, lavender top tubes. Option D, green top tubes. The correct answer is option C, lavender top tubes. Explanation. Lavender top tubes contain ethylenediamine tetrashic acid, which preserves blood cell morphology and is widely used for hematology tests such as a complete blood count. Question 81. Somatic tremor is the result of Option A, muscle movement. Option B, loose sensors. Option C, unequal amounts of electrolytes. Option D, improper standardization of the instrument. The correct answer is option A, muscle movement. Explanation. Somatic tremor is an electrocardiogram artifact caused by skeletal muscle movement, such as shivering, tension, or patient motion during the recording. Question 82. One method to calculate heart rate from an electrocardiogram strip is to Option A, count the small boxes between the R to R interval and divide by 1,500. Option B, count the number of small boxes in the R to R intervals and divide by 2. Option C, estimate by counting R peaks in 10-second strip and multiply by 10. Option D, count the number of QRS complexes in a 3-strip and multiply by 10. The correct answer is option A, count the small boxes between the R to R interval and divide by 1,500. Explanation. At a paper speed of 25 mm per second, dividing 1,500 by the number of small boxes between consecutive R waves estimates the heart rate for a regular rhythm. Question 83. Complete destruction of all forms of microbial life. Option A, sterilization. Option B, germicide. Option C, sanitization. Option D, disinfection. The correct answer is option A, sterilization. Explanation. Sterilization destroys all forms of microbial life, including bacterial spores, which distinguishes it from cleaning and most disinfection processes. Question 84. After obtaining an electrocardiogram tracing, a medical assistant would be expected to Option A, check the patient with a pulse oximeter to verify accuracy of the electrocardiogram tracing. Option B, evaluate the patient's medication list for cardiac-altering drugs. Option C, instruct the patient on the tracing results and cardiac prognosis. Option D, observe the tracing for quality and decide if another tracing may be required. The correct answer is option D, observe the tracing for quality and decide if another tracing may be required. Explanation. After recording an electrocardiogram, the medical assistant should check the tracing for artifact and technical quality and repeat it when necessary rather than interpret the diagnosis for the patient. Question 85. A pulse site used to measure blood pressure is Option A, brachial. Option B, popliteal. Option C, radial. Option D, temporal. The correct answer is option A, brachial. Explanation. The brachial artery is the standard pulse site used with a blood pressure cuff because the cuff is placed around the upper arm and the artery is assessed near the elbow crease. Question 86. Which of the following drug administration routes is the most appropriate for a patient who has nausea and vomiting? Option A, nasal. Option B, buccal. Option C, sublingual. Option D, rectal. The correct answer is option D, rectal. Explanation. The rectal route can be useful when nausea and vomiting make swallowing or retaining an oral medication difficult. Question 87. What drug enhances the effects of another drug? Option A, narcotic. Option B, antagonist. Option C, trade. Option D, synergistic. The correct answer is option D, synergistic. Explanation. A synergistic drug interaction occurs when one drug increases or enhances the effect of another drug. Question 88. The patient has been given a prescription that says the medication should be taken twice daily. This medication should be taken, option A, before bedtime. Option B, once a day. Option C, before meals. Option D, twice a day. The correct answer is option D, twice a day. Explanation. Twice daily means the medication is taken 2 times during the day at the intervals directed by the prescriber. Question 89. The phenylketonuria test is used to diagnose deficiency of phenylalanine hydroxylase, the most common clinically encountered inborn error of metabolism. It is performed on option A, blood drawn from a newborn's finger. Option B, a newborn's fecal specimen. Option C, blood drawn from a newborn's buttocks. Option D, blood drawn from a newborn's heel. The correct answer is option D, blood drawn from a newborn's heel. Explanation. Newborn screening for phenylketonuria is commonly performed on capillary blood collected by heel puncture and applied to the designated screening medium. Question 90. A patient weighs 83.92 kilograms. How many pounds does he weigh? Option A, 185 pounds. Option B, 210 pounds. Option C, 200 pounds. Option D, 195 pounds. The correct answer is option A, 185 pounds. Explanation. Using the common conversion of about 2.2 pounds per kilogram, 83.92 kilograms is approximately 185 pounds. Question 91. A structure that is composed of 2 or more tissue types is called a and an. Option A, system. Option B, organism. Option C, organ. Option D, cell. The correct answer is option C, organ. Explanation. An organ is made of 2 or more tissue types that work together to perform specific functions. Question 92. Choose the answer that corresponds with number D. Option A, ulnar artery. Option B, radial artery. Option C, brachial artery. Option D, cephalic vein. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 93. Family members, such as spouse or children that are covered under the member's insurance policy are known as option A, members. Option B, beneficiaries. Option C, dependents. Option D, subscribers. The correct answer is option C, dependents. Explanation. Dependents are eligible family members, such as a spouse or children, who receive coverage under the insured person's health plan according to the plan's rules. Question 94. Mr. Smith is suffering from an enlargement of the bones in the entire skull as well as in the hands and feet, in addition to thickening of the skin. Which of the following conditions is Mr. Smith suffering from? Option A, Addison's. Option B, Cushing's. Option C, acromegaly. Option D, cretinism. The correct answer is option C, acromegaly. Explanation. Acromegaly results from excess growth hormone after the growth plates have closed, producing enlargement of the hands, feet, facial bones, and soft tissues. Question 95. The main purpose of personal protective equipment is to: Option A, help project a professional appearance. Option B, protect street clothes from getting soiled. Option C, provide the employee a barrier against infection. Option D, systolic pressure below 90 and diastolic pressure below 60 mm of mercury. The correct answer is option C, provide the employee a barrier against infection. Explanation. Personal protective equipment creates a barrier between the worker and potentially infectious material, reducing exposure to blood, body fluids, droplets, or other hazards. Question 96. Every prescription for a controlled substance requires the physician's signature and a number? Option A, Food and Drug Administration. Option B, Drug Enforcement Administration. Option C, Environmental Protection Agency. Option D, Centers for Disease Control and Prevention. The correct answer is option B, Drug Enforcement Administration. Explanation. Controlled substance prescriptions require the prescriber's Drug Enforcement Administration registration number because that agency regulates controlled substances in the United States. Question 97. An obese patient was sent to the laboratory for a complete blood count. Which of the following veins is MOT likely to be the only that the phlebotomist can palpate? Option A, basilic vein. Option B, cephalic vein. Option C, median cubital vein. Option D, sclerosed vein. The correct answer is option B, cephalic vein. Explanation. The cephalic vein lies along the outer side of the arm and may be easier to palpate in some patients when deeper veins are difficult to locate. Question 98. When a person stays in the same position all the time, pressure causes the skin to: Option A, become firm and dry. Option B, weaken and become necrotic. Option C, become stronger. Option D, stay pink and moist. The correct answer is option B, weaken and become necrotic. Explanation. Prolonged pressure reduces blood flow to compressed tissue, which can cause tissue injury, breakdown, and eventually necrosis. Question 99. A normal resting heart rate for the average adult is: Option A, 15-20 beats per minute. Option B, 80-120 beats per minute. Option C, 10-15 beats per minute. Option D, 60-100 beats per minute. The correct answer is option D, 60-100 beats per minute. Explanation. A normal resting adult heart rate is commonly taught as 60 to 100 beats per minute, with individual variation based on age, fitness, medications, and health status. Question 100. The mental and emotional condition, enthusiasm, loyalty, or confidence of an individual or group with regard to function or tasks at hand is called: Option A, morale. Option B, insubordination. Option C, initiative. Option D, tenacity. The correct answer is option A, morale. Explanation. Morale describes the confidence, enthusiasm, and emotional outlook of an individual or group toward its work and responsibilities. Question 101. Which of the following types of gloves can be decontaminated and reused if they show no signs of deterioration after use? Option A, disposable. Option B, utility. Option C, sterile. Option D, examination. The correct answer is option B, utility. Explanation. Utility gloves are heavy-duty reusable gloves that may be cleaned and decontaminated if they remain intact and show no signs of deterioration. Question 102. Protected health information stands for: Option A, protected health information. Option B, private health instructions. Option C, private health information. Option D, protected health instructions. The correct answer is option A, protected health information. Explanation. Protected health information is individually identifiable health information that is protected by privacy rules when handled by covered healthcare organizations and their business associates. Question 103. Postprandial means: Option A, before a meal. Option B, before bedtime. Option C, fasting. Option D, after a meal. The correct answer is option D, after a meal. Explanation. Postprandial means after a meal, so a postprandial measurement or instruction is timed after eating. Question 104. The medical assistant is to collect a prothrombin time test, a complete blood count, and a fasting blood sugar. What is the correct order of draw? Option A, gray fasting blood sugar, lavender prothrombin time, red complete blood count. Option B, light blue prothrombin time, lavender complete blood count, gray fasting blood sugar. Option C, lavender fasting blood sugar, red complete blood count, green prothrombin time. Option D, gray fasting blood sugar, lavender complete blood count, light blue prothrombin time. The correct answer is option B, light blue prothrombin time, lavender complete blood count, gray fasting blood sugar. Explanation. The keyed order places the light blue coagulation tube before the lavender hematology tube and the gray glucose tube, which follows the source's order of draw sequence for these specimens. Question 105. Which of the following is considered a parasitic infection? Option A, Lyme disease. Option B, rabies. Option C, ringworm. Option D, malaria. The correct answer is option D, malaria. Explanation. Malaria is caused by Plasmodium parasites that are transmitted through the bite of infected mosquitoes, so it is a parasitic infection rather than a bacterial, viral, or fungal disease. Question 106. Hypotension is defined as: Option A, no measurable systolic pressure. Option B, systolic pressure above 150 mm of mercury and diastolic pressure above 90 mm of mercury. Option C, systolic pressure of 129 mm of mercury and diastolic pressure of 80 mm of mercury. Option D, systolic pressure below 90 and diastolic pressure below 60 mm of mercury. The correct answer is option D, systolic pressure below 90 and diastolic pressure below 60 mm of mercury. Explanation. The source defines hypotension as a systolic pressure below 90 and a diastolic pressure below 60 mm of mercury. Clinical interpretation also depends on symptoms and the patient's baseline. Question 107. Which of the following is classified as abnormally rapid, deep, or labored breathing? Option A, hypertension. Option B, tachypnea. Option C, hypernia. Option D, hyperpyrexia. The correct answer is option B, tachypnea. Explanation. The source keys tachypnea. Tachypnea specifically means abnormally rapid breathing, while deep or labored breathing may be described with other respiratory terms, so the wording should be reviewed. Question 108. What is the appropriate test used for heparin therapy? Option A, point-of-care testing. Option B, activated partial thromboplastin time. Option C, hemoglobin and hematocrit. Option D, serum separator tube. The correct answer is option B, activated partial thromboplastin time. Explanation. Activated partial thromboplastin time is commonly used to evaluate the effect of unfractionated heparin on the blood clotting process. Question 109. Which of the following types of filing systems requires a cross-reference files? Option A, alphabetic. Option B, subject. Option C, geographic. Option D, numeric. The correct answer is option D, numeric. Explanation. Numeric filing systems require an alphabetical cross-reference or index so staff can locate the patient's assigned number from the patient's name. Question 110. What does the inside address in a typewritten letter need to include? Option A, the salutation. Option B, the body of the letter. Option C, the name and address of the person sending the letter. Option D, the name and address of the person receiving the letter. The correct answer is option D, the name and address of the person receiving the letter. Explanation. The inside address identifies the recipient of a business letter by giving the recipient's name and mailing address before the salutation. Question 111. Tachycardia is a pathology that damages mainly the: Option A, heart muscle. Option B, brain. Option C, blood vessels. Option D, body organs. The correct answer is option A, heart muscle. Explanation. The source keys heart muscle. Tachycardia means an abnormally fast heart rate and can increase cardiac workload, but the wording that it directly damages one organ should be reviewed for accuracy. Question 112. Which of the following is correct regarding contact transmissions? Option A, it involves the transfer of pathogens by food and water. Option B, it involves contaminated instruments, needles, or contaminated hands that are not washed. Option C, it involves transmission of pathogens that remain suspended in air for a long period of time. Option D, it refers to the transfer of pathogens by mosquitoes, flies, and rats. The correct answer is option B, it involves contaminated instruments, needles, or contaminated hands that are not washed. Explanation. Indirect contact transmission can occur when pathogens are transferred by contaminated instruments, surfaces, or hands that have not been properly cleaned. Question 113. A patient's weight should be listed in the patient's chart to the nearest. Option A, pound. Option B, 1/2 pound. Option C, ounce. Option D, 1/4 pound. The correct answer is option D, 1/4 pound. Explanation. The source keys 1/4 pound as the charting precision. This is a documentation convention from the source and should be matched to the policy or equipment standard used in the course. Question 114. You are to draw the blood of a patient. After reviewing the lab order, you realize that you need to draw a complete blood count with differential on your patient. Knowing that this test is drawn in a lavender top tube, which lab department would this go to for processing? Option A, microbiology. Option B, hematology. Option C, coagulation. Option D, chemistry. The correct answer is option B, hematology. Explanation. A complete blood count with differential evaluates blood cells, so the specimen is processed in hematology rather than chemistry, microbiology, or coagulation. Question 115. Demerol 75 mg, intramuscular every 4 hours, as needed for severe pain, is what type of medication order? Option A, single. Option B, as needed. Option C, immediate. Option D, routine. The correct answer is option B, as needed. Explanation. The phrase as needed means the medication is given only when the patient meets the stated need, so this is an as needed medication order rather than a routine or one-time order. Question 116. In a standard 12-lead electrocardiogram, the measurement of current that the heart muscle produces between the right arm electrode and left arm electrode is known as the option A, standard limb lead 3, option B, augmented lead, option C, standard limb lead 2, option D, standard limb lead 1. The correct answer is option D, standard limb lead 1. Explanation. Standard limb lead 1 records the electrical potential difference between the right arm and left arm electrodes. Question 117. The Q wave, if present, is always option A, positive, option B, present, option C, isoelectric, option D, negative. The correct answer is option D, negative. Explanation. A normal Q wave, when present, is the first negative deflection of the Q or S complex before the first positive R wave. Question 118. The layer of the heart that is responsible for contraction and relaxation is known as the option A, pericardium, option B, myocardium, option C, endocardium, option D, epicardium. The correct answer is option B, myocardium. Explanation. The myocardium is the thick muscular middle layer of the heart wall and generates the force needed for cardiac contraction. Question 119. When would a phlebotomist use a multiple sample needle? Option A, along family members who all require the same test. Option B, in a large outpatient laboratory for all patients requiring the same test. Option C, for microcapillary collection. Option D, when more than one tube of blood is to be collected. The correct answer is option D, when more than one tube of blood is to be collected. Explanation. A multiple sample needle allows several evacuated tubes to be filled during one venipuncture without removing the needle from the patient's vein. Question 120. Choose the answer that corresponds with number E. Option A, basilic vein. Option B, radial artery. Option C, cephalic vein. Option D, median cubital vein. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 121. If a finger is excessively milked during a skin puncture, the result will be option A, a decrease in pain for the patient, option B, increased venous blood flow to the puncture site, option C, an adequate of blood for filling several capillary tubes, option D, hemolysis and contamination of the specimen with tissue fluids. The correct answer is option D, hemolysis and contamination of the specimen with tissue fluids. Explanation. Excessive squeezing of a puncture site can damage blood cells and mix tissue fluid with the sample, causing hemolysis and dilution or contamination of the specimen. Question 122. Two employees discussing a patient diagnosis on a hospital elevator with other people present is a violation of option A, patient rights, option B, patient privacy, option C, patient confidentiality, option D, patient insurance. The correct answer is option C, patient confidentiality. Explanation. Discussing a patient's diagnosis where unauthorized people can hear it exposes confidential health information and violates the duty to protect patient confidentiality. Question 123. What specimens require protection from light? Option A, bilirubin. Option B, lactic acid. Option C, blood gases. Option D, cryofibrinogens. The correct answer is option A, bilirubin. Explanation. Bilirubin breaks down when exposed to light, so specimens for bilirubin testing are protected from light to help preserve an accurate result. Question 124. A female patient came into the emergency room due to vaginal bleeding. What is the name of the instrument used to hold open the wall of the vagina? Option A, retractor. Option B, speculum. Option C, hemostat. Option D, forceps. The correct answer is option B, speculum. Explanation. A speculum is used to separate and hold open the vaginal walls so the cervix and vaginal canal can be examined. Question 125. Most specialists are paid by managed care organizations using which of the following methods? Option A, fee-for-service. Option B, coinsurance. Option C, copayment. Option D, capitation. The correct answer is option A, fee-for-service. Explanation. Fee-for-service reimburses the specialist for individual services performed rather than paying a fixed amount per enrolled patient. Question 126. How do you know when you have achieved adequate ventilation for a patient when doing cardiopulmonary resuscitation? Option A, air escapes the nose. Option B, air enters the stomach. Option C, rise of the chest. Option D, you hear a popping sound. The correct answer is option C, rise of the chest. Explanation. Visible chest rise shows that enough air is entering the lungs to expand the chest during rescue ventilation. Question 127. Choose the answer that corresponds with letter A. Option A, cephalic vein. Option B, radial artery. Option C, ulnar artery. Option D, brachial artery. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 128. Dr. Jones and Dr. Brown decide to share a practice. Together, they share patients, expenses, profits, and assets. Which type of medical practice is this? Option A, group practice. Option B, clinic. Option C, partnership. Option D, sole proprietorship. The correct answer is option A, group practice. Explanation. A group practice is formed when multiple physicians practice together and share resources such as patients, expenses, income, and facilities. Question 129. When analysis of a patient flow is reviewed, what does this help a practice determine? Option A, the day of the week that most patients come in. Option B, the number of times per year a patient visits the medical office. Option C, the amount of time the provider sees patients per week. Option D, the realistic time frame for each appointment. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 130. Material safety data sheet information includes: Option A, table of chemical elements. Option B, product manufacturing conditions. Option C, general and emergency information. Option D, information on competitor products. The correct answer is option C, general and emergency information. Explanation. A material safety data sheet provides safety information about a chemical, including hazards, safe handling, first aid, and emergency response information. Question 131. A patient has a possible corneal abrasion and needs a referral. Which specialty is a physician that deals with eye injury and disease? Option A, ophthalmologist. Option B, oncologist. Option C, optician. Option D, optometrist. The correct answer is option A, ophthalmologist. Explanation. An ophthalmologist is a physician who diagnoses and treats eye diseases and injuries and can provide medical and surgical eye care. Question 132. Choose the answer that corresponds with number C. Option A, radial artery. Option B, brachial artery. Option C, ulnar artery. Option D, cephalic vein. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 133. A female patient came into the office for her scheduled routine physical. You are measuring the patient's vital signs. Which part of the brain is responsible for the temperature regulation? Option A, hypothalamus. Option B, thalamus. Option C, medulla oblongata. Option D, pons. The correct answer is option A, hypothalamus. Explanation. The hypothalamus helps regulate body temperature by comparing internal temperature signals with the body's set point and triggering heat loss or heat conservation responses. Question 134. This unit in the hospital is run by physicians and experts in the field of musculoskeletal disorders of bones, joints, ligaments and tendons. Identify this department. Option A, rheumatology. Option B, obstetrics. Option C, ophthalmology. Option D, oncology. The correct answer is option A, rheumatology. Explanation. Rheumatology focuses on disorders involving joints and connective tissues, including many conditions that affect bones, ligaments, tendons, and surrounding structures. Question 135. While Mr. Dillon's hematocrit is spinning in the centrifuge, you perform an automated hemoglobin test on a sample of his blood and record the value as 15 grams per deciliter. You do a quick mental calculation and expect that the hematocrit value will be approximately: Option A, 5 grams per deciliter. Option B, 5%. Option C, 45%. Option D, 45 grams per deciliter. The correct answer is option C, 45%. Explanation. A common screening estimate is that hematocrit is about 3 times the hemoglobin value, so a hemoglobin of 15 grams per deciliter suggests a hematocrit near 45%. Question 136. Another term for outpatient care is Option A, rehabilitation care. Option B, non-ambulatory care. Option C, ambulatory care. Option D, nursing home care. The correct answer is Option C, ambulatory care. Explanation. Ambulatory care means healthcare provided without an overnight hospital admission, so it is another term for outpatient care.